So our group had the female reproductive system. I'm Kayla Friesenhahn.
I'm Aubrey Mitchell.
I'm
I'm
Ria
Grant.
Patel.
I'm Grant Gephardt.
So for the introduction to the reproductive system, the female reproductive system is a pretty complex organ system consisting of several pieces that are responsible for the production of ova, as well as female sexual development and housing of the fetus and development of the fetus during pregnancy. The primary structures of the female reproductive system are the vagina, the cervix, the uterus, the fallopian tubes, and the ovaries. And each of these structures has a unique function for the vagina and for the female reproductive system. For example, the vagina is the passageway for the blood and the mucus during menstruation, as well as the receptacle for the penis during sexual intercourse, and the passageway from the uterus to the outside world for the child during childbirth. The cervix provides a passageway for sperm from the vagina into the uterus. It also prevents foreign objects from entering the uterus, and it dilates during labor to allow the child to pass from the uterus into the vagina. The uterus provides a safe environment for the fetus to develop during pregnancy. It is also where the egg will implant once it is fertilized. The fallopian tubes transport the ova from the ovaries to the uterus. It is also the site of fertilization for the egg. The ovaries produce ova or egg cells, which are the female gametes, which are fertilized by the sperm and eventually develop into a fetus.
So for our first disease for the female reproductive system, we chose yeast infection. So a vaginal yeast infection is a fungal infection that causes irritation, discharge, and extreme itchiness of the vagina. So the reason for yeast infections is the yeast candida is a common yeast within the vaginal area. And when the bacteria of the female reproductive system get off balance, that causes the body to produce either too much of the yeast or too little of the yeast, causing a yeast infection. And this is very common in women. It infects 3 to 4 women at some point in their lifetime. So there are different types of symptoms and ways to diagnose the yeast infection, such as itching and irritation, a burning sensation, redness and swelling of the vulva, vaginal painness and soreness, vaginal rash, and a thick, white, odor-free vaginal discharge, and even a watery vaginal discharge. The 3 most common are itchiness of the vagina, soreness and swelling, and burning sensation. So there are a few different types of treatment methods for a person that get these infections. Since they're so common, there's even over-the-counter medications such as Monostat 1. The antifungal medication is what you would want to take to get rid of a yeast infection. There are different creams, ointments, pills, and tablets. For the pills, there's actually different types of pills and medications that are different lengths depending on how often the woman actually gets yeast infections. There's a 1-day dose, there's a 5 to 7 dose, just depending on how often the woman gets yeast infections.
As Aubrey said earlier, most vaginal yeast infections are caused by Candida albicans, which is a type of yeast fungus. And this naturally occurs in the vagina as part of a balanced mix of microorganisms, including yeast and bacteria, and the bacteria actually will keep the yeast population in check. And a yeast infection occurs when there is an imbalance in that cocktail of microorganisms that cause the yeast to overproduce or to grow into the deeper layers of vaginal cells. Some factors that can increase the chances of imbalance in yeast include antibiotics, which would kill the bacteria that keep the yeast population controlled. Pregnancy due to the increase in female reproductive hormones. Diabetes, when uncontrolled, can also increase the risk of yeast infections. Immune system impairment causes a greater risk of yeast infections, and contraceptives and hormone therapy can cause an increase in risk of yeast infections due to the increased estrogen levels in the patient.
The second disease is polycystic ovarian syndrome, which is a hormonal disease caused by an abnormally high production of androgens, which are male hormones in the ovaries, which causes the egg follicles to not fully reach ovulation. And these immature follicles get kind of stuck and cause these ovarian cysts that give the disease its name. And little fun facts, I guess, are not really fun. Women produce androgens naturally, so all women produce androgens, but more like 1/10 or to 1/20th the amount that males produce. And the reverse of this, is female androgen deficiency. Symptoms include visual symptoms such as excessive facial hair and body hair, severe acne, male pattern baldness or hair thinning, weight gain, skin tags, and dark skin patches, which are rare. And then the non-visual is difficulty getting pregnant and or fertility, ovarian cysts, which give it its name, irregular to no periods at all, especially heavy periods when they have them, headaches, sleep apnea, which is typically a side effect of weight gain, and then pelvic pains. There's no definitive test for PCOS, but to get diagnosed, typically they'll run a blood test and see your androgen levels. Ultrasounds, I had a picture earlier that showed the cysts popping up on our ultrasounds. Normal palpation of a pelvic exam, really test for inflammation or just abnormal size. And then monitoring of estrous cycles, just seeing whether or not your periods are consistent and or too heavy or at all.
The exact cause for polycystic ovary syndrome isn't known, unfortunately, but there are several factors that are believed to play a role. The first of these would be type 2 diabetes, which is when the body forms a resistance to insulin. This causes blood sugar levels to rise, leading to an excessive production of insulin as the body combats the high sugar level and tries to regulate it. And this in turn leads to an excess androgen production, which causes the ovulation challenges. The second is inflammation. Women with polycystic ovary syndrome often have inflammation along the reproductive tract, which stimulates the production of androgen in the polycystic ovaries. And this is known to worsen the condition. And then there is a hereditary factor that's not quite proven yet, but scientists do believe that there are maternal genetic links to polycystic ovary syndrome, as it is most commonly seen between mother and daughters and actually sisters. As far as treatments go, unfortunately, no cure exists for polycystic ovary syndrome, and treatment is restricted to just addressing the symptoms. But some of the ways that they can do this are lifestyle changes, which include weight loss provided by low-calorie diets and frequent exercise that are proven effective in improving the condition, and limiting carbohydrates in order to lower any diabetic risks and kind of keep the diabetes under control, which in turn keeps the condition under control. There are medications. Some of them help regulate the menstrual cycle, such as birth control, which decreases androgen production and helps to regulate the body's estrogen level. There's also progestin therapy, which helps to regulate the periods while protecting against secondary conditions, such as endometrial cancer, which is an unfortunate implication that can happen with PCOS, but it itself does not lower the androgen levels. And then to help with ovulation, there are several medications that exist to help stimulate the ovaries and allow for normal ovulation for women desiring to conceive, because it is possible for women with polycystic ovary syndrome to still get pregnant. And then in conclusion, The female reproductive system is a unique organ system responsible for many hormonal and reproductive responsibilities. It's made of several different working components, some of the main ones being the uterus, which hosts the fetus during gestation. It's the site of menstruation when the uterine wall lining is shed, and it produces the vaginal and uterine secretions. You also have the ovaries, which are responsible for oogenesis, which is just the production of the female ova. They secrete estrogen and progesterone and are responsible for androgen production. You have the vagina, which is the passageway between the internal and external systems of the female reproductive system, and many, many more structures that also serve equally as important functions. While often overlooked, the female reproductive system is delicate yet essential to life. It can be affected by numerous diseases and conditions that can be passed genetically or are secondary to other existing conditions. Regular exams and preventative care are always recommended to keep everything in working order and healthy. And now we have some questions.
So for question 1, it says, what is the most common symptom of a yeast infection? A, itchiness, B, burning, C, pain and soreness, D, A and B, and E, all of the above. So the answer is going to be all of the above because like I mentioned earlier, the 3 most common symptoms of yeast infection are itchiness, burning, and painness and soreness.
So our second question is, what are the main causes of polycystic ovary syndrome? A, type 2 diabetes, B, heredity, C, type 1 diabetes, D, A and B, and E, all of the above. So the answer would be A and B, type 2 diabetes and heredity, due to the overproduction of insulin, and scientists believe that there is a hereditary link between polycystic ovary syndrome.
And then question number 3, which primary structures of the female reproductive system best matches the image? A, endometrium, B, ovary, C, uterus, D, A and B, or E, all of the above. And the answer is going to be C, the uterus, because you have A, which is actually pointing to the ovaries, and B is pointing to the endometrial lining. So C is going to be your correct answer. And that's all we have on the female reproductive system. Thank you for watching.